YouTube channel, OT Live Talk. And on today's episode on life as a nursing student, and also in nurse, we're talking about something that has been a pressing issue among nurses all over the world, and also nurses in Nigeria. So today we have and also together we're going to be talking about two topics actually. The first one, which is very detrimental to all nurses, and I'm sure you guys want to listen and pay attention to them and also add your contribution in the comment section. We're talking about toxicity in nursing and also nursing specialty. We all have our specialty that we want to go into. We all have the part of nursing that we'd like to explore, as she said. So first of all, we're talking about nursing toxicity. So can you tell us what you understand by toxicity, then nursing toxicity?
Okay. According to everybody has their own definition of what toxicity can mean, especially how it applies to our everyday life, especially like interacting with different people or meeting people. So according to my own definition, I'll describe toxicity as the act, or let's say an act, whereby a person is trying to bring conflict or like negativity into your own life or like your everyday living. So toxicity. Now, nursing toxicity. We know what nursing is, and I've said what toxicity is. So nursing toxicity applies to the nursing profession as a whole. That's where, your own professional colleagues are trying to cause conflict within the workplace or, within yourselves as the nurses, which creates a very big negative imbalance amongst the profession as a whole. So yes, that's why I understand like that.
Okay. Can you please tell us?
What I understand by toxicity? Like she said, everybody have their own definition of toxicity. So like she said everybody have their own definition of toxicity. My own definition is totally different. Well, it's not different, it's actually similar. But me, I would just say toxicity is just being negative towards a particular person. Yeah, that's my own definition of toxicity. Like being negative towards somebody, like having negative opinions, being negative. Like when you are being negative, it doesn't have to mean that you are like bringing the person down. You do not even have to like hurt the person like directly to be negative towards the person. You can hurt the person by indirectly by talking down. Yes. So yeah, that's my own definition of toxicity. And in nursing, it's very, 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 very common. You will always see it there. You will always see the toxicity there. In nursing is a very, very toxic profession. I won't even lie. This is not something that because of what I've experienced or something. I'm not the only one that have experienced it. Everybody, as a student, I experienced this toxicity, and I felt, maybe because I am still a student, I will be like, okay, I'm free from it. I will be free from it when I become a nurse like every other person that has shown me this side. But no.
That's the experience. Only in the labor market.
It is well.
Can you share one or two experiences you've had?
If I share one as a student, I will have many, because I tend to be a difficult person. I wouldn't even lie. That one, it's not something that is perfect. I'm a difficult person. So when you're trying to be toxic towards me, I'm like giving it back to you, like, please just stay far away, like, bad energy, stay far away kind of thing. Just stay far away. So one of the experience would be the one where we were on the clinicals and I was using like a earphone. I was going to the ward. I won't say it was wrong because I've not gotten to the ward. I've not even gotten to the ward. I'm on my way to the ward, and when I get to the ward, I will remove the earphones. I've not even started working. It's not even working hours yet. Then a particular nurse saw me and told me And I didn't even know he was a nurse, because how am I supposed to know you're a nurse?
She was not on uniform, I
You were
guess.
not on uniform. It was not even a she. Did you know the funny thing about this thing is it wasn't a she? A guy, I expect. No, like, but I understand, Sha, I understand. So it wasn't a she, it was a E. You saw me, you were not on uniform, or maybe I do not know that, oh, this is your uniform, because the female nurses have a different uniform and the male nurses. So me, I felt you were wearing your normal black and white shirt as an office man, and maybe you probably came for checkup in the hospital. Then you told me to remove my earphones, and I felt, oh, this one are all these oversabi people where they always walk up and down. And the next thing, remove your earphones, bro.
Started talking anyhow.
He started talking anyhow. That I was like, why will you tell me to remove my earphones? Who are you? Maybe I was wrong at that point, but I didn't know you. You didn't even say, oh, I am so. I am Sergeant so from so.
That's that.
So you get? You did not even introduce yourself. You just came to me. Hey, you remove your earphones, and I'm like,
I'm guessing his approach self was
very, very
But
bad.
let me guess, did he say he was going to report you or something?
If he did not say he was going to report, he reported.
As expected. This is what we are talking about.
The toxicity
This is exactly what
that
we are
came
talking about.
after that one was
the beginning.
that was being
No, actually, this is the small.
that was being toxic. Then I got to the person he reported to, the people he reported to. Then they collected my phone. They seized my phone for good 2 weeks. Guy, I did tertiary institution. I don't do secondary school. Even if I offend person, say okay, like the person is my senior colleague, it should be like a posting punishment kind of thing. But you collected my phone, hey, my life, Jesus Christ, I cried.
Well, gonna do this.
Actually, Kamli, do you have any experience you'd like to share to us?
Yes.
Everybody has one or two experiences.
Yes.
Okay.
So, this happened on a particular day when I was on posting, OMG posting. Okay, I'll talk about the fact of cultural difference. Yes, and I've always experienced this thing being an Igbo girl entering into the world, and I have in fact, personally, I do not have a problem with Yoruba people. I mean, this difference thing that always occurs, it could be based on people's personal experience, but personally, I haven't really had. Okay, let's forget that one. Sha. Coming back to the posting, OMG posting. Hey, my people. Okay, I entered into the world, and this actually she's a Muslim, but she's still like Yoruba and all that. So she just decided to pick on me as a person, me.
I think nurses are even fond of that, like picking on the particular
As
person.
soon as she
Just one
the worst part
person
is
to, like,
the worst
do
part
something.
is she asked me what's your name, and as soon as I told her my surname, that was where it all happened. It all started from. She said there was this particular patient that she asked me to do vaginal examination for, and I said okay. Do you know, funny thing is, after doing the VE, everything that she finally assessed after I assessed was completely correct. When I say correct, she just wanted to pick on me just for my surname. Oh, no problem, I'll start looking at her. So what really now happened that blew everything up was the fact that I didn't know she was praying. Like I said, she's a Muslim. So I entered into the nursery room. I wanted to cross, and I think her prayer mat or something, there's this kind of division she did on the floor, and because I was in a hurry, I needed to just pick up something from the room. So I mistakenly crossed the line, and I just said I'm sorry because I saw she was praying. Please tell me, how can somebody in the middle of prayer, if you know that you are really communicating to God in the middle of prayer? No, because I just wanted to understand. Is it because it was my surname, or seeing me as a person just decided to imitate her whole being, or because because I just crossed that line. In the middle of communicating with God, she asked me to come back. That why would I cross that line? I said, Ma, I am very sorry. She now said, can't I see? Or did I not see? Is it that she even said, am I stupid? Or didn't I see the line? And I said, I'm very sorry, Ma. That I was just in a hurry. I needed to pick up this form that you normally, this pathograph exactly. That's what I needed to just pick up. The pathograph paper. Now waiting I chop insults that day. I said, no problem. I left after apologizing. She now later came out again and continued to pick on me. I was just looking at this woman like. And funny thing is, I'm not going to lie, I always loved Wanji, like always. But as soon as she did that thing to me, I was like, Wanji, just go to hell. And I don't do it. I don't do. Just for that single act, I said no. So if I can experience something like this, if I now go outside, that means I'm definitely going to see people that are worse than how she is. So
I've been seeing since when you've been outside the labor market, I've been seeing people.
I've seen no. If it's that one, my people are powers.
So generally, in toxicity, me myself, I've experienced more than enough for me to share. As a male nurse, there's no way you don't have experienced one or two talk down some people's talking to you about you being in the nursing profession, a female-dominated profession. And I just want to put it out there now that nursing is actually not a female-dominated profession. It's not even gender-based. So it's a general profession where everybody can participate in. So, Miss Obi, what do you think are the main causes of toxicity in nursing, or what do you think causes it?
One main cause, the main cause of the pain, like you said, it will still be the ethnicity, the tribalism. Yeah, that's the word. Tribalism is one of the main causes of the toxicity in nursing. Once you are not a Yoruba in a Yoruba-dominated environment, there will be a problem. And when you are when you are not Yoruba in a Yoruba-dominated environment, there's a problem. And when you are Yoruba in an Igbo-dominated environment, there's a problem. It's just like that. Tribalism is one of the causes, and the mentality, and they always want to be like, what they did to them, I want to also do it to another person. Which is not even right. But then let's continue, Jerry.
I have another cause of toxicity is the fact that some of these people, they like to carry titles on their head. They should just write it inside paper. Use sellotape, paste stamp on top their forehead, wear it like crown. That is another cause of toxicity. When they see, okay, now this is my junior, and should be a Morgana, I have rights to tell them to do like whatever. That is another big problem. And there's no interpersonal relationship. Like I said, so far they plastered the organ on their head. That one is. They don't really want to. They don't even care like how
senior, junior.
Exactly. Let me even chip in one thing. Like, even if they use 1 month to senior in service, 1 month or one, they will still use it. Like they have to address somebody one time that you senior this person with 1 month. Why will you sit down and make the person do all the work and you are claiming to be our boss? Like I do not. Okay, let's look at it this way. You could actually be somebody senior with 1 month, but there can still be this interpersonal relationship, and you can still order the person to do a particular work because so far you two you are working. As far as you are working, don't be saying you go just sit down.
That's what she said. Like
that's what I'm saying.
There has to be this form of relationship they share. But when it comes to nurses, from my experience, when it comes to like the nursing leaders, they tend to like see the juniors as like that gap is always alarming. It's always there. Normal, it should be there, but there should be this senior junior relationship that we should actually share. You understand? So in our own experience, somebody that seniors somebody with just 1 month, there should be there's a level of authority that person still carries, but at the same time, that level of authority shouldn't be as alarming as you just the junior just doing every task in the world and everything, and you are just there sitting down just watching. So another thing is nursing leaders. I wanted to say that one too, but nursing leadership also impacts in toxicity in nursing. As they said, our matrons, I don't know, probably the kind of training they've received right from school. Because even in school, I know you guys have experienced this. Your seniors will also be talking down. You can't even pass your senior without giving this. You have to bow your head and all of that shit. So even in the world, even in the labor markets, in the hospitals that we work in, our matrons and all of that, some of them are very, very cool. Honestly, I've worked with very cool matrons.
Yes.
Even they are your boss, and at the same time, they make you feel welcomed into the profession.
But it's very rare. Very
It is
rare.
actually rare, but they make you feel welcome. But some of them just, I don't know, they just feel probably what they experienced, they should also pass it on, and that's another major cause of toxicity in nursing. They keep on passing down the toxicity,
just
something that's exactly something that
you did not like.
exactly you didn't even like it as
You
a
did it to
exactly
you and you never liked it, and you're doing it to another person.
Another cause of toxicity is your personal upbringing. Don't go and carry rubbish from the house and come to the workplace and come and be displaying nonsense and come and be toxic near myself because I'll give it to you.
Some people don't bring marital issues and old issues down to work, then the whole working environment is already disorganized already. Like you don't even, the stress of nursing is already there, causing nursing burnout, which I talked about in one of our episodes. The stress is there, the workload is already there. Then all you need is just a free environment to like do your tasks, a free environment to do what you want to do and clock out. But nursing toxicity where your boss is, you are doing one thing, your boss is like telling you that one, she's not even contributing, she's not even doing anything, you're just, everything just, the weight is already on your head.
And you know that they do not even like it when you have to like now say, ma, even when you address it, and even if you are addressing it in the coolest tone, they will still
You
tell
see it as
you are rude. Like you are very rude. If any way you address the issue, they will tell you that you are a very rude person. And no, I do not mind, my darling.
I do mind, to be honest, because this thing takes a toll on our lives. Honestly, there's no way it won't affect us. I'm sure there are different ways in which nursing toxicity have affected you, and I love you guys to share with us. But for now, let's just talk about the main causes. You guys have highlighted some. She has highlighted some. Is there any other cause that you think you guys can talk about besides the
Majorly, these are
So let's talk about the effect of nursing toxicity on our lives, our personal life, not even our nursing life, but our personal lives, then our nursing lives, at our jobs, workspace, work environment, the effect of nursing toxicity on it.
The effect of nursing toxicity on me. See me. No. I'm actually being dramatic, but yeah, I love being dramatic. See me, like see my neck. Now because of toxicity, it's the toxicity that is causing all this. Weight loss. Weight loss. You'll be thinking, what will I do that this person will not have to complain about me?
Yeah.
What will I not do? Don't do this, don't do that. If you do this one, they'll say, oh, you did not do it well. Bro.
You're feeling tired.
I'm already tired already.
Thank you, Kobe Fett. I also want to talk about the various various means that we ourselves can stop toxicity in nursing, or we can even control it to the various means whereby incoming nurses that are coming into the profession freshly, they won't have to experience that much of a toxic environment in the hospital or their training ground.
I want to say something stupid. The toxic back, and they're bringing the toxicity.
She's the one promoting toxicity in nursing.
And they're
You are
bringing
saying she's the one promoting it. No, it shouldn't be like that.
Don't do like that. I'm just chill.
I'll say something.
Don't be toxic.
I'll say something. I feel like this toxicity thing is not going to end. Why? Because
You can't end.
Gen Z. That's another thing. Gen Z.
You can't talk down on them and expect them not to talk
Exactly.
back. Like that's not them being rude. That's just the generation. They just feel I have to express. It's gonna take a toll on my mental health. You get?
Like how the older nurses have been trained, and although yes, it has been passing down to me, the younger one, but now curriculum self don't change. everything no go be like how
Actually,
Yeah.
old
then
trend.
but nursing.
Exactly, everything is different. Boiling down to information technology. Okay, people that are toxic now, they don't even sabi operate system. If they want to operate system now, so it's not Gen Z. They say, please, this is
I
I
know that you are
don't know how
very
to. I know you are very good in it.
I am in
Help
the
me.
system.
I mean, come on. So
Okay, as Gen Z nurses, how do you think you can stop reduce toxicity in nursing?
as a Gen Z nurse, it go hard. Because some people have fixed mindsets. Some people have really, really fixed mindsets.
As for me, I don't know about this too.
No, it's not going to be hard. I'm going to be honest.
Okay.
Because now we just, you know that they will leave us. They will leave us. We'll still be the one in
That
the
was what I'm
system.
saying now.
So when we're in the system, we're the ones that will now know that, oh, this is now, I did not like this when it was done to me. I'm not going to do it to the other person. And if you feel you're already doing it to the other person and the person calls your attention to it, just immediately, oh, I'm sorry, we'll fix it. And you should also work on yourself too. I'm sorry, we'll fix it. Work on yourself. Those two things, I think, because you know that the old ones are matrons. If you call them, if you call their attention to this, that this thing is telling a toll of
They are
you.
never wrong.
You did something. They'll say they're not wrong.
They are never wrong.
And you're very rude. You're very, very, very
They are
rude.
never wrong.
You get, do you understand? But you as you understand, you have more information, you are more learned than them. I'm not going to lie to you. But you have the information and you know that these things, they are not good. And I won't like it to be done to another person. Don't do it to them. And if you find yourself doing it to them because you've probably experienced it many times and they call your attention to it, please, just say sorry and work on it. Thank you very much.
Exactly, like having a free and open mind. Just be free and open, like to everybody.
Don't even see anybody as your junior. Everybody
Exactly.
Can't
We're all
be too-
nurses.
like that. We're all
Just
nurses.
relate. Because to be honest, we actually need everybody at one point or the other.
Yeah.
Now that you are carrying title on your head, if you need me in future where I'm CEO,
Are you saying
if there is
future?
anything,
Are you saying future on the board? If
On
you
the-
need me
well,
on the board, you say
and you
please
be-
come and tweet say swap duty. Your roster is this. I saw your roster. Even with this, you will not come and meet me. You will not even have the mind to come and
Exactly,
meet me because
there's no
you
mind.
are not even.
You've not even been nice
You are
to
not
me
even
at all.
nice to me. And do you know the funny thing? They used to bully you to do that thing. They
Before
will bully
God.
to collect it. But you will meet me again.
This girl, she be witch, no talk. She's a witch. But I don't understand. Oh well. Thank you very much for your contribution to this whole video. Honestly, I can't appreciate you guys enough. Thank you for the viewers listening to us. I'm sure you guys have one or two contributions to add. Also, you guys can leave it in the comment section. So now we are moving on to nursing specialties. First of all, what are nursing specialties? Can you?
Okay, so nursing specialties are like different divisions or areas of specializations which people like want to further, or as the word says, specialize into. So we have psychiatry, we have anesthetics, we have O&G.
Who do you feel is specialties?
Yeah, we
Yes.
agree too. But I'm sorry, I can never venture into it. Then peri-op nursing,
We have
travel nursing, a lot.
we have quite a lot. Which one would you like to go into?
Oh yeah, psychiatry.
But I
Miss Obi, which would you like to go into?
think I prefer the anesthetics nursing.
I prefer anesthetics nursing, honestly.
Okay,
Why?
one out.
Why?
No problem.
Why do I prefer anesthetics nursing? Basically, starting my personal reason, first of all, as a male nurse, I like a job that keeps me on something, up and doing. You understand what I'm saying? More like AIE, but at the same time, this is not really AIE. But personally, as something that will give me money when you get.
Fun is very important.
Very, very
So
important. Aesthetics nursing is, for me, is one of the hardest nursing specialty. Whereby we have to deal with the lives, the operating room, calculations of drugs and everything. So, I love something like that. I love a tasking job.
president, general, I want it.
Don't mind them. I love the taxi job. So that's my own personal reason of going into aesthetics nursing. You have a reason why you're going into psychiatry?
Yes. Okay, I'll say no. I will just basically talk about the facts about okay, so why I love my specialty or why I want to go into psychiatry. It's just passion. Like right from when we went to posting, I just found it to be very, very interesting. So ever since then, I'm like, no, I think this is what I want to go for. So yes.
Your reason, man. She also chose aesthetics also. So.
I will not lie, I will not steal. Florence did not call me. So the reason
They said nothing is a calling. All of us, Florence called us. One night, we received a call from. Didn't she receive a call?
I received.
She carried her lap like she's not going to do. So she called you. You're already in the profession.
Exactly.
yeah, I was called, right? Now me pick call when on my own, but yeah, I picked the call. But no, I'm never talking about the calling. Why I picked anesthetics nursing is because I googled. I saw that anesthetics nursing. Calm down now.
I'm listening.
Yeah.
Okay.
They get paid cool cash, and that's what I want. They are the most paid nurses, or one of the most paid nurses, and I need money. I need to buy a champagne and get in Dubai. So yeah. But I really love it. I love it compared to I do not feel we have to like sit with the patients like that. When you're an anesthetist nurse, you do not like really
It's not bedside.
converse with the patient or have to. That's what I'm always trying to prevent. That's what I'm trying to prevent. Not always because I'm already there, so I'm just like trying to cope with this. But anesthetic nursing, you are not with the patient 2/7. They just come for surgery and you do your job.
Yeah.
Every other person.
Let me add to
and
that.
monitor for some time. You get.
Let me add to that. They're not with the patient 2/7, but let's say when it's time for surgery, they will come and inform the patient about the procedure that is going to happen.
Be done. Yeah.
You know, I personally, I don't know whether they tell them the kind of anesthesia that is going to be used. That
They
will
do.
break it down.
They
Them
do.
What they do. Okay, still part of preparing the patient.
They do.
for
I actually
surgery.
know an anesthetist nurse that will sit them down. Like it will be like a proper health talk. She will sit them
that's how it's
down.
supposed to be actually.
She will sit them down
That's how
and
it's
explain it to them and tell them, oh, Makoyino, stuff like that. If they don't understand Yoruba, she will speak like that.
Involved in
In
it.
it, yeah.
So what do you think is the most profitable nursing specialty?
Like I said before, when I googled,
How do you think psychiatry is the most profitable? Because I'm also
Actually,
seeing
one
blogs
of,
saying-
It's also one of,
but travel nursing too. But I would not keep my hopes very high. Travel nursing is actually very good and very profitable, but I won't keep my hopes high because of the country I have decided to log into. I find myself in ticket. I did you like clown?
Oh well. So I want to ask a question here. I believe there are misconceptions generally about nurses. So let's talk about nursing specialty. What are the common misconceptions that you've heard about nursing specialties? Let's start with your personal interests. So
No, I've not even heard anything about anesthetic nursing, so I think I'm safe. But I've heard so many things about, oh, if you're a psychiatric nurse, they used to have the signs, symptoms of, okay, they used to have
you have to be mad to treat a mad person, that kind of thing.
No, it's not even about you have to be mad to treat a mad person. They will like,
they always generally tell me that it's mad people. You are treating mad people.
No, you don't understand. There was a time that somebody was telling me that he knows many nurses and a psychiatric nurse. That woman too, she used to do like somebody that is mad. That he knows an orthopedic nurse and the woman has done hip replacement. And I'm like, hey, I don't see that kind of thing before. But then that's not something that we should Please help me define. Look for the English. I don't know what
We should say.
not say like we should. It's not. I need a word for it. Not we should say. That's not something that we should, because somebody has this and they are treating patients like this. That is supposed to cut this person. And they say, oh, he will cut it. He will cut it. He knows.
I'm not going to cut it. Let's continue. So, Candy, we're talking about, she has talked about some misconceptions about psychiatric nursing. Which one have you heard of that is busting your brain?
That misconception about psychiatric nursing. To be honest, I don't think I have heard any, except this one that she just mentioned now. You have to be the person.
They've just had
mad people. But aside that, I don't think I've heard any other misconception.
So another question is, how do you think nursing specialty duties differ from general nursing duties? Like, you guys are general nurses, right? Now, how do you think when you become or what have you seen or learned during your course of training that nursing specialists do that differ from general nursing?
So first off, I would say they correlate with each other, because whatever you are doing as a general nurse, it also applies to your specialization. The only thing is that the specialization is like a more complex form of the skills you do as a general nurse. It's not like you don't play your part as a general nurse. Okay, you want to sell medication now. We all do that. Even when you're specializing, you play your part of selling medication, but there are still like other features.
They are more specific.
Yeah, they are more specific tasks you need to do towards your patient. So basically.
So thank you, Candy, for your contribution. I feel honored. So, what advice would you like to share for the incoming nurses, the young nurses that are still training and choosing their nursing specialties?
First of all, I would like to say this: life no hard. That's the first thing that you just need to understand. Life.
I should be specialty. I'm 12K. I'm just joking, okay.
Then just follow your dreams and try to understand or find your passion. Don't let anybody force you to do what you don't want to do or what you don't have to do. And I promise you, you'll be fine. So that's it.
Again, thank you so much, Candy.
You're welcome. So yeah, I just feel that if you know that you want to specialize, you should find what you love during your postings. I realized that I do not like O&G during my postings. I realized that I love perioperative nursing during my posting. So just find what you love and go for it.
She loves me, but she's not doing it.
Ew, big. So just during your postings, find what you love and go for it. That's just it. And if you know what, go for another thing like that. Life no hard, like
Actually,
I said.
I'm still going to go welcome this in life. No hard. Just be you. So thank you guys for coming up on the YouTube. Thank you guys for coming for my you don't finish. Thank you guys, please. Thank you guys for coming. I really appreciate your presence. Come to
No, can't be catching the game.
Hey, open!
Thank you so much. I'm so sorry for pronouncing your name. Miss Obi Faith, my love.
Who that you?
Thank you so much for coming on the show today. I really appreciate you guys. Thank you for your contributions. I'm sure you guys have learned a lot about nursing toxicity and also nursing specialties. And I'm sure you guys have a whole lot to say. So drop it in the comment section. Like and subscribe. Let's go. It's not that. No, she's a darling. Honestly.
I'm not a darling.
She's an admirable.
Hi guys.
I'm also a darling. She's in my heart, to be very honest.
When would I be somebody's heart? That's fine.
Jokes apart, she's my love. That's why she's here. If she doesn't love me, she won't be here. So thank you guys. Thank you so much for
Thank you guys. Like, subscribe, share, comment.
Bye.
Bye.